Assalamu alaikum. Now I would like to talk about this disease, this B and T cell disorder. Start with this. This is a baby with SCID, that is severe combined immunodeficiency disease. In here there is defective interleukin 2 receptor gamma chain. There is defective interleukin 2 receptor gamma chain, and it is X-linked. This is X-linked, and in here there is ADA deficiency, that is adenosine deaminase deficiency. Okay, in here the presentation would be failure to thrive. There is failure to thrive, there is diarrhea, there is thrush, there is recurrent bacterial, viral, fungal and protozoal infection. This is high yield. In SCID there is recurrent bacterial, viral, fungal and protozoal infection, and as a treatment the first and foremost thing we have to do, that we know that when a baby uh, when a baby comes into this world, then we provide some vaccine to uh, to make this baby safe from this kind of disease. But in such cases, in B and T cell disorder, especially in SCID, you have to avoid live vaccine. You can give kill vaccine, but you have to avoid live vaccine, and give antimicrobial prophylaxis and IVIG, and bone marrow transplant is curative. And as a treatment, if you do bone marrow transplant, then it is curative. Okay, in here the findings is there is a decrease T cell receptor, there is decreased T cell receptor excision circle track, there is decreased T cell receptor excision circle, and this is called track. There is decrease track, and there is absence thymic shadow. Can you tell me another disease where there is absence thymic shadow? Yes, in DJOR syndrome there is absence thymic shadow. In here there is absence thymic shadow, and in SCID there is absent germinal center and T cell. And this is all about the first one, SCID. This is a picture of a woman who has this blood vessel is showing in her ear, in her pinna of the ear, and this indicates that this is the picture of a telangiectasia. In this is the woman who have ataxia telangiectasia. In ataxia telangiectasia, what you have to remember, that there is defect in ATM gene. First of all, defect in ATM gene, and that's why these ATM gene defect failure to detect DNA damage, so it fails to halt the progression of cell cycle, and that's why mutation accumulate, and this is autosomal recessive. So first of all, the name of the disease, that ataxia telangiectasia defect in ATM gene, it is autosomal recessive, and the name suggests ataxia, you will get ataxia, and you will get this telangiectasia, and you will get another thing, that angioma, that means spider angioma, and in here is IgA deficiency. In here there is IgA deficiency. So the mnemonic is all the A's like ATM gene deficiency, autosomal recessive ataxia, angioma, that is spider angioma, and in here there is IgA deficiency, and you will get increase alpha fetoprotein. You will get increase alpha fetoprotein and decrease IgA, decrease IgA GE. So AGEH is decreased, and there is increased risk of toothing, leukemia, and lymphoma. So for remembering the ataxia telangiectasia, what you have to think that you need to think all. That means the mnemonic is all, that is all the A's first. You will get a defect in ATM gene, there is ataxia, there is angioma, which is spider angioma, there is IgA deficiency, there is AGEH, immunoglobulin A, immunoglobulin G, immunoglobulin E is decreased, and there is increased alpha fetoprotein, and it is autosomal recessive. And that's all about ataxia telangiectasia. This is another picture of ataxia telangiectasia. This is the picture of hyper IgM syndrome. In hyper IgM syndrome, what you have to remember that defective, this is the T cell, and this portion there is defective CD40 ligand which is present on T cell, defective CD40 ligand on T helper cell. In T helper cell there is defective CD40 ligand. So the class switching will not gonna happen because there is defective CD40 ligand. So defect in class switching. There is a defect in class switching, and defect, it is X-linked recessive. This is X-linked recessive, and in hyper IgM syndrome you will get severe pyogenic infection, and the organisms are pneumocystis, CMV, and Cryptosporidium parvum, and these three organisms actually causes this hyper IgM syndrome. Can you tell me again that pneumocystis, CMV, and Cryptosporidium causes this hyper IgM syndrome? In here there is normal or increase in IgM, normal or increase IgM, but age, AGE, immunoglobulin A, G, and E is decreased, and failure to make the germinal center, and their failure to make the germinal center. And the last disease is Wiskott-Aldrich syndrome. In Wiskott-Aldrich syndrome, what you have to remember that Mr. Text in Wiskott-Aldrich syndrome is Mr. Text. That means mutation in WAS gene. There is mutation in WAS gene, and there is mutation in WAS gene. There is other feature. There is recurrent pyogenic infection. There is recurrent pyogenic infection. The recurrent pyogenic infection. T for thrombocytopenia, E for eczema, T for thrombocytopenia, E for eczema, X for X-linked, and another T for tumor. And this is all about Mr. Text. For remembering this Wiskott-Aldrich syndrome. In Wiskott-Aldrich syndrome, There is GM is decreased, but AE is increased. In viscoelastic syndrome, GM is decreased and AE is increased. And that is all about B and T cell disorder. Inshallah, you will be benefited.